So it is time to talk about the male reproductive system, chapter 13. And I am not a male, but my husband, Anthony, is. Anthony, say hi to the class. All human fetuses start out as female. So what changes during the course of development that you get these characteristics versus these characteristics? And what I mean by this is that his shoulders are much broader than mine. If we were to stand up, he's actually about a foot taller than me. He has a larger head. He has a pronounced Adam's apple versus mine. You can see it right there. Facial hair, I do not have, I don't shave, you know. So what happens in development that makes these secondary sex characteristics occur? Well, the answer is, if it is going to be a male baby, there's a system called the Wolffian system that is turned on about week 6 in development that changes the female organs to the male organs. And so that changes on the outside. We call those secondary sex characteristics. And then it also changes, of course, the genitals as well. And so that's all I need you for. If you'd like to mosey off. Thank you so much. So we are going to talk about the male reproductive system. If I can make this big. One more time. Male reproductive system, chapter 13. Nearly done with the textbook, nearly done with learning medical terminology for the year. We're going to talk about anatomy, physiology, pathology, diagnosis, and treatment. Okay, so here are some combining forms we have for the male reproductive system. You have andro. Andro means male. Androgen is the development of a male. Crypto is hidden. This is referring to the testes of a male. And when we get to diseases and disorders, we're going to see a couple words with crypto in it. Epididymo is epididymis. The epididymis is a specific piece of male anatomy that sits on top of the testicle. Gono is seed, because sperm, the females make eggs, the males make sperm. Sperm are considered seeds to fertilize the egg. Orco is also testes or testicle, and we see the word orchido, orco, orchism. We'll see that a lot this PowerPoint. Plazo is development formation. Prostato is the prostate gland. Spermato is referring to either to an individual spermatozoa or to sperm in general. Vesiculo is a seminal vesicle, which is a part of male anatomy. And then zoo is animal or life. We have seen every single one of these prefixes, and we have seen every single one of these suffixes, but I would like to just reiterate that seal is a hernia, swelling, or protrusion. Pathy is disease, of course, and then stomy is surgical opening, and trophy is development or growth. Here are a few more terms. We have Bolano. This is specifically referring to the glans penis, which is the head of the penis, the sensitive part of the male anatomy. We have gyno, which means female, woman, gynecologist. We'll talk about that in chapter 14. Semini, or semen, which an I, is semen or seed again. So you have spermato, which means semen, and you have gono, which means seed as well. So there's 3 words there. Per is through. Peri is around. Ation, process or condition. Osis, abnormal condition. And rhea is flow or discharge. So we've seen those last 5 previously. The functions of the male reproductive system are less labor intensive than the functions of the female reproductive system. The male facilitates conception, and conception is that sperm meeting the egg by introducing sperm into the female reproductive tract through the penis and the urethra. And so obviously they also have to produce the sperm in order to be able to introduce it. Here is the male anatomy. It's as if we've taken a male and cut them in half down the midline. And so you're looking at like the left half of the body, okay? So you have a bladder, that is the urinary bladder. And you'll see that the male anatomy travels around the urinary bladder. Let's start at the bottom and the testicles. The testicles are held in the scrotum. And the scrotum is a sac of skin, tissue, that holds the testicles away from the body. The reason for this is sperm cannot develop at 98.6, or core body temperature is actually 99.6 degrees. They will be mutated. They have to be in a cooler environment. So the scrotum holds the testes away from the body at about 96.6, 97.6, which is perfect for sperm development. Inside the scrotum are two testicles, typically. There are reasons for one or none to be there. Inside the testicles that is not being shown are seminal vesicles, and we'll talk about that on the next slide. On top of the testicle is the epididymis, and this holds mature sperm. And then we see the vas deferens, this word here, that travels from the epididymis up and around the bladder and eventually meets with the other one from the other testes and finally forms the urethra of the male. Okay, on our way around the bladder, we actually go through a couple of glands, or we meet with a couple of glands. We have the seminal vesicles, and we'll see what they produce in a later slide. You have the prostate gland, and then you have the Cowper's gland here. So males, they are responsible for two things through the urethra: urine, obviously from the urinary bladder, but also semen and or ejaculate. Ejaculate is made up of sperm from the epididymis, but then also three different fluids from the seminal vesicle, the prostate gland, and the Cowper's gland. So we're gonna see what those fluids are in a few slides. The urethra, after the vas deferens meet, then travels down the length of the penis. The penis is either flaccid, as shown in this picture, which means it is not in an aroused state for sexual intercourse, or it is in a aroused state. This tissue that you see all along the penis can fill with blood. And as that happens, the penis changes shape from pointing down to pointing kind of up and at an angle. This is called the shaft of the penis, and at the very tip, or not the very tip, but at the end of the penis, the distal part of the penis, because distal means farthest from the body, is the glans penis, which is the sensitive part of the penis. Now, every single human male is born with something called a foreskin. That's the typical name, also known as prepuce, but it's a foreskin. And this covers the glans penis. It is common in European religious nations, Christian nations, for circumcision to be performed, and that removes the foreskin from around the penis. It is not common in many other parts of the world, but there are two ways that a penis can look depending on if they were circumcised or not. So if we were to take a testicle and cut that in half and look at what's going on inside a testicle, you have these seminiferous tubules. Seminiferous tubules are where spermatogenesis takes place. Spermatogenesis is the formation of sperm. And then as they mature, they move up into the epididymis there, waiting for ejaculation to occur. Mature sperm don't have a very long lifespan. If they're not utilized by ejaculation, then they get reabsorbed into the male's body, and the pieces of it are reused to either make new sperm or for other things. And here's the vas deferens coming up off the testicle, and you can see it has blood vessels and nerves, making the testes innervated, which means they have nerves and therefore sensitive. So the epididymis supports the testes and holds that mature sperm. The vas deferens transports sperm through the spermatic cord. And the spermatic cord carries sperm to the pelvic region and the ejaculatory duct, which is also the urethra. Those other glands that make up the rest of what ejaculate is, because it's semen, no, I'm sorry, it's sperm, but sperm, even for the sheer amount that are produced each ejaculate, which is millions of sperm per ejaculation, they're only a tiny bit of what all ejaculate is, and the rest is produced by these glands. So we got the semen, and then the prostate gland secretes a fluid that lowers the acidity of the semen, because sperm work best in a basic environment, or an environment that is more basic on the pH scale. Cowper's gland lubricates the body surfaces of the male, the internal surfaces, and cleanses the urethra of traces of urine, because once again, urine is acidic, and the semen, the sperm prefer a basic environment. And then semen itself is sperm-containing fluid expelled during sexual intercourse. The outer parts of male anatomy consist of the scrotum and the penis. The penis contains the male urethra, which is both the urinary system exit and the male reproductive system exit. During an erection, it becomes enlarged and stiff. The glans penis contains the external urethral orifice, so the opening to the outside for urine or ejaculate to go through. And circumcision is removal of that foreskin. And I have a picture to show you guys that. So the before with foreskin or without, it's a drawing. It's not like a bad picture. Okay, so in what structure of the male reproductive system does spermatogenesis begin? They're inside the testes. And they're called seminiferous tubules. And what is the purpose of the fluid secreted by the prostate gland? Sperm do not like acidic environments, so the prostate gland creates a base that lowers the acidity of the semen. And that's really it for the male anatomy. When we get to the female anatomy, we are not any more complicated. Neither system is very complicated. We just put the female reproductive system has to do a lot more of laboring of bringing the baby into the world. The male reproductive system is solely for producing semen and inserting it into the female reproductive tract. So all the bits and pieces, the whole point of it is to produce semen. For the female reproductive system, it's to house the baby and grow the baby and raise the baby and feed the baby. And so it's a lot more, there's a lot more kind of going on. Diseases and conditions, you can have anorchia or also anorchidism. Sorry, can't speak apparently. And that is a genetic condition where testicles are not developed. One or both, it can happen, typically one, and that can decrease fertility. Benign prostatic hyperplasia. So the prostate, I didn't mention, for every organ of the male, the female has an equivalent. So the penis, the penile shaft is, the equivalent would be the vagina. The glans penis, the equivalent would be the clitoris. The testicles, the equivalent is our ovaries. We don't have all these ducts, the females don't. We just have the uterus and the fallopian tubes. But the males develop something called a prostate, which females have no equivalent for. And this prostate gland, let's go back actually. This prostate gland, remember this is cut in half, it actually circles the urethra, the entire thing. And very typically, very common as men age, this prostate becomes enlarged. It also easily leads to cancer. Prostate cancer is one of the most common cancers in males, and that's later on in another slide. But it becomes enlarged, and so when the prostate enlarges, it squeezes the urethra. and actually makes it difficult to void or go to the bathroom. And it makes it difficult for men to maintain erections. So benign prostatic hyperplasia is the overgrowth of the prostate, but it's not prostate cancer. It's abnormal enlargement of the prostate gland. It's characterized by frequent and difficult urination. It's also called prostomagaly, which makes sense. Cryptochordism, here's that crypto word. So crypto is referring to hidden, and then orchid is testicle, and ism is pertaining to. So as male babies are being developed in the uterus of the mom who's growing them, the testicles start out in the exact same place the ovaries would be if it was a female. So it's up in the abdomen. And then through development, before the baby is born at 10 months, the testes are supposed to move out of the abdomen and up against the body here in this pre-scrotal, pre-pubic region. And then you might have heard the phrase, when men hit puberty, their balls drop. And so that is what this is referencing here. This normal position is where the testicles should be as the males hit puberty. So they're farther away from the body so they can produce sperm. Cryptoorchidism is the failure of the testicle to move down from this abdominal position. It stays up in the abdomen. It's a developmental defect in which one typically, or both, testes fail to descend. If left untreated, it may increase risk for testicular cancer and infertility. I think they can surgically move it down. I think that's how they do it. Epididymitis is an inflammation of the epididymis that is sitting on top of the testes. It is characterized by pain, blood in the urine, and an inflamed scrotum, and it can lead to infertility as well. And hydrocele is swelling in the sac around the testicle, typically seen as swelling of the scrotum or the testes. I've read that it is common in the first year of life for newborn males and typically resolves on its own, but it is not normal for an adult. And technically, sexually speaking, reproductively speaking, you guys are adults, so that should not be a thing. Whew, phimosis. So we haven't talked about circumcision yet, but phimosis is when the foreskin on the penis is narrow and cannot be pulled back from the head of the penis, which is how it normally should work. The foreskin covers the glans penis for protection, but then pulls back like a covering can pull back, and the head of the penis can be exposed, you know, for cleaning purposes or through sexual intercourse, for sexual intercourse, I mean. Phimosis is when the foreskin is narrowed and pinched around the head of the penis and can't be pulled back. It has to be surgically fixed. Prostate cancer is a malignant tumor of the prostate. It's characterized by dysuria, so difficulty urinating, pain and blood in the semen, and is one of the most common cancers in men over the age of 50. It's a very common cancer. You typically need to get part or all of the prostate removed. Okay, so sexually transmitted infections, I don't really want to get into the topic of this because we have a whole unit over it in your 10th grade year. But all sexually transmitted diseases, and we are talking HIV, human immunodeficiency, human HIV, which can lead to AIDS, chlamydia, gonorrhea, trichomoniasis, syphilis, which is a bacteria, why can't I think of any of these? That was a lot of them. Human papillomavirus, herpes simplex virus, all of the STDs or STIs, because now we call them infections instead of diseases, all of the STIs can lead to infertility in both males and females, all of them. They can cause scarring of the reproductive anatomy and the inability to produce semen or to house an egg. And so these are diseases that are transmitted through genital contact. Testicular torsion can happen due to an injury. It can happen randomly. It can happen while you're asleep. But what happens is inside the scrotum, the testicle twists. And by doing so, it actually cuts off the blood supply to the testicle because it pinches the blood vessels that are leading to and from the testicle, and you can lose your testicle through testicular torsion. So define each disease or condition and identify the meanings of the word parts. Cryptorchidism. Ism is pertaining to, crypto is hidden, and orchid is testicle. So pertaining to the testes that doesn't descend to the scrotum. Oligospermia. Oligo is scanty, which also means little, and sperm is sperm. So it's a condition of abnormally low number of sperm in the semen. Men who have abnormally low number of sperm in semen, not zero, but just like so few sperm, they're technically infertile. It's nearly impossible for them to fertilize an egg. And so if you grow up and if you want children, because that's a decision you can make on your own, but you're not getting pregnant, then, you know, it might be an issue with the mom, but sometimes it's very much an issue with dad and he has abnormally low number of sperm. So you have to get both of you checked. Diagnostic tests and procedures. That was weird. I just like stuttered there. Culture and sensitivity refers to sending something to a lab to see if something will grow. In this case, they're talking about bacteria because we can't grow viruses really. I mean, we can, never mind. Just bacteria is what we're talking about. And typically we're talking about a sexually transmitted infection. So this is a culture. Culturing the bacteria is putting it on a plate of nutrients and seeing what will grow. To identify what's causing any kind of infection, because like a UTI or something, or sexually transmitted infection. Once you have something grown and identified, then you do sensitivity testing on it. And so you are trying to see what antibiotics can treat it so that you can go back to the doctor and be like, you need to have your patient take this antibiotic. And the doctor's like, cool. And he tells his patient to take that antibiotic. A digital rectal exam. In this case, the digit is referring to a finger. And the rectal part is referring to the rectum. And we are examining. So for men, as you age, I told you that prostate can become enlarged and does for many, many, many men. And so one of the ways, the easiest way to see if your prostate is enlarged is to feel for it from the rectum. Because the rectum is pressed right up against it. And so a doctor will put on a glove and put lubrication on a finger or two. I think it's two, not to scare you men. And then he will insert the fingers into the rectum to feel if the prostate gland is not appropriate. It's not, if its size isn't appropriate. If you ever go to a doctor, and it'll be a urologist for the most part, and you're saying, I'm having trouble urinating, that's the first thing they're going to do. The fluorescent treponemal antibody absorption, or FTA-ABS test, is with syphilis specifically for syphilis. Syphilis is a sexually transmitted infection, caused by Treponema pallidum. That's the bacteria's name. And so this is a test specifically to test for syphilis. You'll get typically a blood sample, and they do this for a blood sample. Transrectal ultrasound guided prostate biopsy. TRUS. Once again, the easiest way to get to the prostate is through the rectum. So in this case, I don't want to get it wrong. A procedure in which a needle is inserted through the wall of the rectum into the prostate to obtain a tissue sample for testing. It is the most common prostate biopsy method. I told you many men suffer from enlarged prostates, and that prostate cancer is one of the most common cancers in men over 50. So this is the easiest way to get a biopsy to see if your prostate is cancerous. Sorry, my throat's like itchy. Prostate-specific antigen assay. Assay is study of PS, or the PSA for short, is a test to determine the level of prostate-specific antigen, or PSA, in the blood. Elevated levels of PSA are associated with enlargement of the prostate and prostate cancer, unfortunately. Rapid plasma reagent is another syphilis blood test. Really don't want y'all to have syphilis, guys, so we have a lot of tests for it. Syphilis is a horrible disease, and I would talk more about it, but we actually have a whole unit about syphilis. Not only we talk about syphilis a lot next year. Semen analysis. I'm sorry, I lost my mind for a minute. This is the microscopic evaluation of semen. So a male will have to ejaculate into a cup, and that'll be sent to a lab. And in the lab techs will look at semen numbers, semen movement, sperm numbers, sperm movement. It's part of a fertility study to confirm the result of either your infertility or to make sure a vasectomy was performed correctly. A vasectomy is when we cut, let me go back. It is a reversible method of making sure you can't get people pregnant, right? So we have these vas deferens we talked about here. A vasectomy is cutting the vas deferens on both sides, on both testicles, and cauterizing it, so using heat to seal off the ends. So this way sperm cannot travel through the reproductive system. It does not interfere with your ability to experience sex, but it does mean that you should not be able to get a female pregnant. It's not always 100% effective, but you would do a semen analysis after you had a vasectomy done to make sure that your semen does not contain sperm before you go and have sex without condoms, hopefully with only one person that you're married to, and not have many sexual partners. Testosterone level is a test to check your testosterone levels. There's lots of reasons that hormones are too high or too low in human bodies. So testosterone level. A thyroid function test is the panel of tests to determine how well the thyroid is functioning, because abnormal thyroid levels can aggravate male reproductive disorders. In the VDRL, the Venereal Disease Research Laboratory, so the venereal diseases, once again, are dealing with sexually transmitted infections. It's an older but still commonly used blood test that screens for syphilis. In many places, the VDRL has been replaced by the RPR. So, what are two laboratory tests that can be performed to test a patient for syphilis? We just said them, the VDRL or the RPR. And why might a physician order a fasting, which means non-eating, you haven't been able to eat, blood sugar test for a male patient who has erectile dysfunction? Well, they are checking for glucose levels because abnormal glucose levels can affect blood to the circulation to the penis and could cause erectile dysfunction or the penis not able to have an erection. Circumcision, I said I had a picture. So part of the picture is this one, but this is an already circumcised baby. So you can't see the before. So let me find what I need. So if you look in your textbook on page, is this the right one? Yes, 375 in your textbook chapter, whoops, you will see an uncircumcised penis, which is how all babies are born, with that foreskin over the head of the penis, and then a circumcised penis, where you can see that the foreskin has been removed, exposing the glands of the penis. There is like a minuscule chance that this decreases the rate of penile cancer. It was originally done for religious purposes. Now it's done because the culture that it's done in just finds it common, and that's how they think penises should look. It's not a necessary surgery. It doesn't really affect the health of the baby. And in fact, in the act of circumcising the penis, very low, but the risk is there that they can very much damage the penis of the baby as well. So it's a personal choice. That's all it comes down to now at this stage of development in the world. It's a personal choice. Circumcised baby, non-circumcised baby. Electrocautery. I told you that in a vasectomy, when we cut the vas deferens, we then cauterize the two ends of the tubes so that they can't meet, so sperm can't travel through it. And so that's the electrocautery is the most common way that vasectomies are performed. An orchidectomy is removal of a testicle, usually due to injury or possibly testicular cancer. A radical prostatectomy is the partial or full removal of the prostate. So when that happens, it can affect your sexual life. It might not be possible to have an erection, but if it's that versus dying from prostate cancer, I mean, most people are going to choose to have the prostate removed. So the vasectomy I've talked multiple times about already, but here is a picture of that vas deferens being cut. Look, it's an outpatient procedure, guys. If this is ever something that like a wife wants you to do after you've had 3 kids, or that your wife and you just don't want kids and you know that, you can go get a vasectomy. And you go into the office, they numb the area with topical, I think topical, and then they go in and it's just a little cut. So they cauterize it. You actually walk out of the doctor's office this like 20 minutes later and you recover over the weekend. You put ice on it so it doesn't swell too much, and then you're done. And you don't have to worry about having babies if you don't want them. But let's say you do this procedure and then like a couple of years later, you and your partner decide, no, we really want kids now. Good news. These are reversible. And so you can have a vasovasal ostomy, which is just reversing a vasectomy. And so what happens there is it's a surgical procedure in which the vas deferens that were cut are restored together. So good. Define each of the surgical procedure and defining word parts. An orchiopexy is testes and surgical fixation. So it's surgical fixation of the undescended testes into the scrotum. Prostatectomy is removal of that prostate. Through that truss, we remove the prostate through the transrectal ultrasound guided prostate biopsy. Okay, so a couple of common medical abbreviations. BPH, benign prostatic hyperplasia. That's when the prostate is overgrowing. DRE is that digital rectal exam to see if the prostate is enlarged. GU is genitourinary. That deals with actually both males and females, but specifically the male because the genital tract is the same tract as the urinary tract. HPV is human papillomavirus. RPR, the rapid plasma reagent to test for syphilis, and then that truss again to remove part or all of the prostate. A couple more. HSV is herpes simplex virus. It's another STI. PSA is prostate specific antigen. And then TERP is transurethral resection of the prostate. So now instead of going through the rectum, they're going through the urethra. Excellent. One more chapter to cover, and then you will be done learning for the semester, which is good because we're in the last 2 weeks of the semester. So excellent. Have a great day, guys.